to me, the main role of scientific advisory committee is to ensure that there is an ethical and transparent process to review and evaluate a variety of submissions that come to us to make sure that ultimately the patients and families with brain cancer will benefit from the new forthcoming research. So I participate in my private capacity, and of course I'm a volunteer to SAC as a result of personal family experience with brain cancer. I think that if we're talking about a hope of curing brain cancer one day, or improving quality of life for these patients and extending their life, biopharma is the best chance we have. Living in Australia, we know that we don't have access to as many treatment options as would have larger markets like US and Europe. And I hope that the foundation will be able to attract these treatments to Australia. So brain cancer is a devastating condition for those of us who've seen a patient with brain cancer. It's not something that you can forget or overcome ever in your lifetime. So as a result, because I understand what it does to the patient and to the family of the patient, their children, their wife, etc., I can say that until I live, I will always want to see an opportunity for cure. I don't know if we'll find the cure in my lifetime, but I certainly will work for that purpose for as long as I can. My hope is that in the future, families would not be losing their husbands and fathers and sons and daughters through the devastation of brain cancer. Most definitely, Australia has a number of really talented, bright clinicians. We have a very good network in oncology and in brain cancer. Australia has very qualified clinical research organizations, and with the new government commitment to clinical research and biotech in Australia and reduction in tax to 70%, I think Australia becomes a very cost-effective proposition, and we certainly have a lot of patients who would love to try treatments with us. My real interest is medical education and how these are changed through what we call futuristic view. So the role of artificial intelligence and gamification in changing how we educate the next generation of clinicians. So I do a lot of volunteer work for a global foundation of medical education.